Imagine that you're feeling sick. You know something is wrong, but you can't quite put your finger on what exactly it is or how to get healthy again. Do you go to the corner pharmacy and just buy every over-the-counter medicine they have? Do you call a doctor? If so, which one? Hi, I'm Dr. E.N.S. Ray here for DR3 and the SBHC. Today, I'd like to explain what we do and how our approach is more targeted, efficient, and clinical than many business coaches or cultural surveys you may be considering. Sticking with the medical analogy, think of it like this. The SBHC is your business's primary care doctor. We give your business regular blood tests to help you understand where the pain points are. DR3 is your business's surgeon. We give your business targeted diagnostics and in-depth policy and procedure surgery when things have gotten a little bit too specialized for the SBHC. Together, DR3 and the SBHC use the organization as the individual, or OT, framework as the basis for all of our analyses. This means that we think of your business as if it's a single person, with different departments as the body's organs and different employees as the organ's cells. When we identify a concern for your business, we are identifying a collective problem, not calling out an individual. It's like when a doctor checks your oxygen saturation and finds it low. They don't try to find which blood cells are carrying oxygen and which ones are struggling. They focus on the root cause of why your cardiovascular system isn't performing at peak efficiency. Your people matter, and how well they work together is one of the best indicators of a healthy business. Our job is to identify where collaboration in your business is crumbling and prescribe the proper policies to rebuild those relationships. Let's talk a little bit about what this looks like. The SBHC focuses on high efficiency assessments. These are streamlined, research-backed tools designed to give you maximum insights with minimal disruptions to your team's workday. We use the 5-factor and dark triad models to understand how people perceive the psychology of your entire company. For the 5-factor model, we measure openness, conscientiousness, extroversion, agreeableness, and neuroticism. For the dark triad model, we measure Machiavellianism, narcissism, and psychopathy. Don't let these names scare you. Every organization has some level of these elements. We measure them to ensure that they are being channeled into healthy competition rather than becoming a corporate pathology. Keep in mind that these measurements are made on your business as a whole, not on any single person. If you ask us to give you the results of each individual employee, we won't. That would be a misuse of the data and a major violation of our ethics. So, if this isn't telling you each individual employee's perception, then what are we saying? Well, just like an X-ray tells a doctor if you need a simple splint or a full cast, our assessments tell us whether your business needs a simple policy update or a deep dive diagnostic intervention. The SBHC strongly encourages our clients to maintain their business's health with routine checkups. This helps us to monitor your business's psychological health over time and make sure that the policies and procedures we've prescribed are working as intended. It's like monitoring for high cholesterol. Sometimes diet and exercise just aren't enough, so a medication may be added. We need to regularly reassess to make sure that that policy or procedural medication is working as intended. The SBHC generally works with businesses that have around 10 to 100 employees. There's some flexibility in there for things like franchises that may have multiple locations, but we try to use Dunbar's number as our rule of thumb cutoff. DR3 is our high-touch or critical care unit. We work to dig deep when the SBHC refers a client to us, or when the client is just too unique for the SBHC's standard assessments. DR3 diagnoses corporate personality disorders and pathologies with more advanced methods to respond to the root causes. DR3 functions like the specialist, the surgeon, and the physical therapist all rolled into one. Our advanced techniques help us to monitor your business's vital signs in real time and let us work with corporations that may have thousands of employees. But because DR3's work is so specialized and customized, there's no standard pricing plan. That's part of why we strongly encourage clients to get their SBHC assessments first. The pricing and the results are more predictable, and clients may not actually need more in-depth interventions. Whether you work with DR3 or the SBHC, we will continue to emphasize that we diagnose your organization, never an individual. This goes for every employee, manager, and owner. We look at the group with a growth mindset, meaning we are looking at opportunities for change, not punishment. If you are interested in finding new opportunities for your business to grow, we encourage you to reach out to DR3 and the SBHC. Our website and contact information are down in the description for this video. For DR3 and the SBHC, I've been Dr. Ian S. Ray, and as always, thank you for your time.